All right, so we're doing a little Botox today for this lovely patient who has a little bit different reason for needing Botox. A lot of patients come in wanting to do Botox for wrinkles in the forehead, and that's very common. But one of the less known uses for Botox is for muscles in this part of the face right around the angle of the jaw. And so for some people, this muscle can be very big, which can cause the jawline or the lower part of the face to appear wider or more square. But it also causes a lot of problems for some people who grind their teeth, who have a really strong muscle there. They grind, they can have temporomandibular joint or TMJ pain, and so this can be a great treatment for that. So what we start out doing, I'm going to have you turn your head just a little bit that way. We want to kind of locate where that muscle is. So the first thing that I do is I kind of take a look at where the angle of the jawline is, and you can feel the bone back here. So I'll kind of mark out what we call the inferior border, and then come back here and kind of feel where the jawbone ends back here. So kind of right about there. So that's kind of the angle of the mandible. And that muscle comes down and inserts actually down on the mandible there. So let me have you kind of clench your teeth together and relax and clench. Clench again and relax, and then clench real hard. Relax and clench one more time. You can kind of see my finger move out there as that muscle really firms up there. So we kind of mark that as the anterior border. That's kind of as far forward as we want to go. We don't want to go any further forward than where that muscle ends there. One more time, clench for me and relax. Great, you can really see it there. One more time, clench and relax. Okay. So along that, we want to stay pretty low back here for where we're doing the Botox, and kind of keep that just directly in the belly of that muscle there. Don't want to go too far forward because there are muscles in this area that help move the mouth when we smile and when we speak, and so getting Botox into that area can cause some asymmetries there. So let me give you this here and we'll go ahead and get started. First thing, let me see a little alcohol swab. I'm just going to kind of clean the skin off on these little locations where we're doing the injections here. All right, doing okay so far?
Yeah.
Okay. All right, so we're going to start right over here. We've got a little distraction device there that just helps not feel any of the pain with any of the needles. So with this, we start, let me have you pinch or clench one more time there. Good, and relax. I'm just going to go right in that area, a little pinch here. Doing great. I'm going to go down into the belly of the muscle. Okay, another pinch here. Doing great. Go down towards where the bone is. Again, that's where that muscle inserts, so you can really find it well there. Just about 3 or 4 little spots in the muscle there. Put about 5 units of Botox in each one of those spots. This treatment is a little bit different in the way that it works as well, with Botox that are meant to relax those muscles in the upper face to get rid of wrinkles. You'll see results from those injections in about 5 to 7 days, and it lasts for about 3 to 4 months. Because this treatment is meant to weaken that muscle to the point that the muscle actually shrinks, it can take about 6 weeks or so before you really see the full results of this treatment. But because that muscle shrinks down and it takes a while to build back up, results are often good for 6 months to a year. So this can be a great treatment for someone either for slimming the face cosmetically or for medical reasons of having teeth grinding or TMJ pain. Thanks.